Vanakkam. Welcome to this course on classics in neuroscience. In this series of videos, we have been looking at the development of neurosurgery and how neurosurgery was practically developed as a field by Cushing and further evolved after Cushing. In this video, we look at epilepsy and how neurosurgery was a core tool in the armament of the therapist or the clinician to relieve patients from the debilitating symptoms of epilepsy. Treatment and therapy of people with epileptic seizures has progressed considerably in the last century, starting with the earliest description of the seizure or the types of seizures by Hewlings-Jackson, where using his observations of the Jacksonian march of how seizures proceeded from one part of the body to another part of the body, he suggested that maybe there was a focal lesion somewhere over the motor strip. Hewlings-Jackson was able to persuade Horsley in 1886 to perform surgery, who found a vascular scar in the motor area, and removal of this scar essentially cured the seizures for that patient. However, that was a dreamy story that happened with that patient, but somehow not every case was as simple as that. There were several factors that prevented progress. These are lack of precision in cortical localization. We have discussed this many times. The importance, the critical nature of cortical localization towards the ability to remove specific irritating focus or irritating foci, those nuclei or those regions or those set of neurons that cause the irritation. It was important to identify them with considerable accuracy and precision. And also there may be presence of complications, there may be other things that may complicate, and also there was not sufficient operative or post-operative care. These are the good old days. Of course, Fedor-Krauss essentially performed electrical stimulation of the human cortex and found the first evidence for the motor strip in humans, and he suggested that epileptic seizures and their symptoms can be improved by removal of irritation due to tumors or other local pathology, or maybe there was a vascular scar or these kind of things. Later, one of the leaders of the field of brain surgery, Otfried Forster, he worked using similar methods, that is using surgery to relieve patients from symptoms of epilepsy. Wilder Penfield studied with Cushing and also then joined Forster to study epilepsy in depth, essentially to perform in-depth studies of cerebral scars due to post-traumatic focal epilepsy and cerebral vasospasms. This led to him getting the considerable experience that he needed to develop further methods that he went on to develop. Later, as we have seen in the previous set of videos, Penfield moved to Montreal and essentially established the Montreal Neurological Institute, and Wilder Penfield essentially established himself practically as the leader in the relief of epilepsy. So, he performed focal electrical stimulation under local anesthesia. This was critical because the patients were able to describe what was happening, or he was able to observe the motor actions, the ability to interrogate the patient on the mental effects of the stimulation. So, this helped to localize the epileptic foci. Later, EEG was introduced as a tool to identify and localize the irritating foci. Also, Herbert Jasper was a leader also from Montreal, who performed EEG studies on patients, but he also parallelly performed electrophysiological studies in animals, and it was identified that in many cases the temporal lobe was the origin of generalized seizures. By 1950s, resection of the temporal lobe for relief from the debilitating symptoms of epileptic seizures was a very popular and relatively successful methods. This method was usually performed on one side of the brain only, or unilateral resection was what was performed, until unfortunately in 1953 William Scoville decided that he was going to perform this resection on both sides. That is, he performed the first bilateral temporal lobe resection in patient HM. This essentially led to this extraordinary loss of memory in patient HM, and essentially leading to the founding of the field of cognitive neuroscience. Now, as of now, by modern methods, relief from epilepsy involves work by a team of neurologists and neurosurgeons, and the success rate is now as high as 80 to 90%. This involves computer analysis of EEG and a whole bunch of methods to localize the irritating focus, and very focused removal of the tissues and other methods, leading to an extraordinary rate of 80 to 90% success rate with practically very minimal to zero mortality, that is today. With this, we come to the end of this video. In this video, we looked at the neurosurgical approaches to treat epileptic seizures. Thank you for your attention.